Venous thrombosis, the most invisible killer. Venous thrombosis is a hidden killer, so everyone should be aware of the dangers of thrombosis. More than 80% of venous thromboembolisms have no symptoms before the onset, but once they develop, any diagnosis will be too late, and the situation will often be very serious. For such high-incidence diseases, everyone should not only understand and treat them after being afflicted, but also understand and prevent them in advance, because the best treatment time for venous thrombosis is only 3 days after catching it. It is almost impossible to completely dissolve a blood clot that is more than 3 days old. Once the blood clot exceeds 2 weeks and becomes a chronic blood clot, it will inevitably have sequelae. Venous thrombosis easily leads to pulmonary embolism and is fatal. It is the third most common cardiovascular disease after ischemic heart disease and stroke. Pulmonary embolism caused by venous embolism mostly occurs in the first 2 weeks of embolism, such as acute embolism, which is more easily treated. Once the sloughed embolus happens to arrive at the pulmonary artery and the pulmonary artery is tightly blocked, people will die quickly, much faster than myocardial infarction, and there is no rescue or recovery time. What is venous thrombosis? How is it formed? Venous thromboembolism, VTE, includes deep vein thrombosis, DVT, and pulmonary embolism, PE. The two are related to each other and are two clinical manifestations of venous thromboembolism at different locations and stages. Among all the veins, because the veins of the legs are the farthest from the heart, and the erection of humans also causes the venous blood of the legs to overcome gravity to return to the heart, so the deep veins of the legs are the most prone to thrombosis, which is usually called deep vein thrombosis, DVT of the lower extremities. In simple terms, venous thrombosis refers to blood clots that occur in deep veins, usually in the lower legs, thighs, pelvic membranes, or arms. Venous thrombosis can occur in people of any age without any symptoms, but it is usually accompanied by swelling, pain, and skin redness. If deep vein thrombosis is not treated, part of the clot may rupture and enter the lungs, causing a blockage in the lungs, called pulmonary embolism, PE. Pulmonary thrombosis may cause chest pain, difficulty breathing, coughing, hemoptysis, and irregular heartbeat. If you experience any of these symptoms, you must seek immediate medical attention. Deep vein thrombosis will not go away on its own. Only with medical services can patients diagnose and treat blood clots through medication or, in rare cases, surgery. Thrombosis is nothing minor. Again, venous thrombosis appears asymptomatic and will not be fatal for a while, but if it develops until the blood clot flows to the lungs and becomes a pulmonary thrombosis, it will develop fiercely and abnormally, causing great harm. It kills people all at once, and even if one is saved, the disability rate is extremely high, there are many sequelae, and there is a risk of recurrence. According to data on the CDC website in the United States, as many as 900,000 people, 1 to 2 out of 1,000, are harmed each year in the United States. It is estimated that approximately 350,000 Americans are diagnosed with DVT each year, and they do not know that they have the disease. 60,000 to 100,000 Americans die of venous thromboembolism each year. Within 1 month after diagnosis, 10% to 30% of people will die. Sudden deaths accounted for a quarter of the total, or 25%. In Europe, 500,000 people die from venous thrombosis each year, more than the number of deaths from AIDS, breast and prostate cancer, and highway traffic accidents combined. Among people with venous thromboembolism, 1/3 to 1/2 will develop long-term complications, thrombosis syndrome, such as swelling, pain, discoloration, and scaling of the affected limb. 1/3, about 33%, of patients with venous thromboembolism will relapse within 10 years. The number of venous thromboembolism hospitalizations in the United States exceeds 500,000 annually. The 3 elements that form venous thromboembolism are 1. Venous wall damage, 2. Slow blood flow, and 3. High blood coagulation. From the source of this disease, let us see who is prone to suffer from venous thromboembolism. Long-term bed rest, pregnancy, postpartum, advanced age, obesity, patients with malignant tumors, patients with poor cardiac function, varicose veins, and those who use the internet for a long time after trauma, because of low body movement, slow blood flow, stasis, and vein wall damage. People with these conditions are at high risk. American experts published the 7 major factors of thrombosis on the website of Prevention magazine, mainly including: Number 1. Sedentary lifestyle. This includes traveling by air, driving or riding in a car, working long hours in front of a computer, playing on your phone, playing games on the computer, etc. It is best to stand up and walk around every 30 to 40 minutes, so that the movement of the leg muscles can be used to help venous blood flow. In addition, bending and stretching your feet can also play a similar role. According to statistics, sitting for 90 minutes will reduce the blood circulation of the knee joint by 50% and increase the risk of deep vein thrombosis by 10%. Number 2. Long-term use of contraceptives. The estrogen and progesterone contained in some contraceptives may increase the concentration of clotting factors in the person taking the drug, which may increase the patient's risk of blood clots. Similarly, some hormone replacement therapies can increase the probability of blood clots in patients. Before using these therapies, you should go to a regular hospital and ask a professional obstetrician and gynecologist to assess the possible risks. Number 3. Weight and height. Obesity increases the risk of thrombosis because it reduces the mobility of the body and can lead to weakened blood circulation. Women who are over 1.68 meters tall and men over 1.83 meters are also at increased risk of developing blood clots. This is because the higher the height, the farther the blood travels against gravity, resulting in a decrease in blood circulation, which in turn increases the risk of clotting. Number 4. Arrhythmia. Many people do not know that they suffer from arrhythmia, because in most cases it has no symptoms and is usually difficult to detect. Long-term arrhythmia increases the risk of blood clots. Conditions such as atrial fibrillation, which increases the risk of thrombosis in the upper chamber of the heart. This is because the irregular heartbeat prevents blood from being completely injected into the ventricles, and the blood flow rate will slow down, and thus begin to collect in the upper cavity, which may lead to thrombosis. If the blood clot flows to the brain, it can cause a stroke. Number 5. Injury of blood vessels in the legs. Any major trauma to the leg may cause blood vessel injury, leading to the formation of blood clots. In addition, studies have shown that major surgical operations, especially operations involving hips, lower abdomen, and legs, increase the risk of deep vein thrombosis because it makes the patient temporarily unable to move the body. Therefore, patients should undergo regular rehabilitation exercises under the guidance of doctors after surgery. Number 6. Genetics. Approximately 5% to 8% of the U.S. population has one of several genetic risk factors, also known as hereditary thrombosis, in which genetic defects can be identified, thereby increasing the risk of thrombosis. For example, the Leiden mutation, the fifth coagulation factor gene mutation, is more susceptible to blood clots. There are also certain kidney diseases, antiphospholipid syndrome, an autoimmune disease, and inferior vena cava problems. Other genetic diseases such as abnormal fibrinogenemia and protein C deficiency can also increase the risk of blood clots. Number 7. The elderly. Although blood clots can occur at any age, the older the person, the higher the risk. People over 60 years of age are more likely to suffer from blood clots. Although aging is inevitable, a healthy lifestyle and knowledge of diseases and proactive prevention can delay the aging process, thereby reducing the risk of blood clots. How to prevent? 1. Eat less high-fat and high-sugar foods to control weight and reduce blood viscosity. 2. Exercise more to promote blood circulation and reduce the probability of thrombosis. 3. Drink plenty of water, which is good for blood circulation, reduces blood viscosity, and can prevent thrombosis. 4. Regular blood tests, blood sugar, blood lipids, and coagulation function can detect blood problems in time and help us find problems early and prevent them early. For the early use of anticoagulant drugs for high-risk groups, active anticoagulation. The arrival of venous thrombosis is silent, and it is easy for people to rush to its existence. The danger is indeed fatal. Let us advertise to relatives and friends, let's take precautions together. Life is precious, do it and cherish it. Thanks for watching today's video. More is on the way soon, so stay tuned. Like and subscribe to keep up. Goodbye.